Well, good afternoon, everybody. I'm Gary Shaw, the president and CEO of Nantucket Cottage Hospital. Just to give you a brief update today with my partner, Roberto Santamaría from the Department of Public Health. We just wanted to talk a little bit about both of the areas that we oversee, the hospital and then what we do in the community. But for an update at the hospital, as it relates to COVID, RSV, and flu, we are definitely seeing an uptick in all of those particular elements of infectivity. And we'd like to see it go down. We'd really like to have your help at the Cottage Hospital prevent transmission and limit the need for heavy surges at the Cottage Hospital, which we're seeing in vaccines and also testing. The current state is that we know that we've got a relatively large population of vaccinated individuals on the island, and we're becoming more and more boosted. We've been able to add a number of booster clinics that are showing that the availability is there and that not all of the appointments are being taken. So we think that we've elevated enough access for that to meet the community demand currently. But people that are deciding that they need to be tested, they're either testing with an over-the-counter type test, and then if they're positive on that test, those tests typically are not PCR tests. And they need to be confirmed with the PCR. So we're getting requests for PCR testing that then show there's a large amount of those that are negative, and that can be confusing to a lot of people in the community. The PCR is the gold standard that shows whether there's really viral particle there, and so although it's good to have options to test, make sure that you get a confirmation test if you need it. People are coming down with symptoms that are mimicking colds, upper respiratory infections, body aches, and through PCR testing, they're finding that those symptoms in vaccinated individuals and boosted individuals are relatively mild. But it's odd in that as we were looking at COVID and what it could have done to you 2 years ago or a year and a half ago without a vaccine, what we're seeing is that the vaccines are doing their job in preventing a lot of these individuals from being hospitalized with serious illness or even dying. Now, that said, we encourage that if you do have symptoms, you do get tested so that you can understand what you have. But if testing isn't available, let's say over the holidays, we advise you to stay home, quarantine as you should until those tests become available. Otherwise, they're available through scheduling on our websites and many other places throughout the community. The emergency room has been relatively full with individuals coming in, a lot of children coming in with RSV and flu and some COVID. And we have had a number of admissions to the Cottage Hospital, which has been generally almost full or full with a number of things, everything from falls and broken bones to flu and RSV and kids and COVID. And we have had to fly a couple of individuals off for upper level of care. Typically when folks are not vaccinated, we're seeing pretty severe illness. So the guiding principle for us is to say masks work, hand washing works, distancing works, but by all means, be vaccinated, get those boosters to lower your ability to have a severe illness. That's the update from the Cottage Hospital. Roberto?
Yes, thank you, Gary. So one of the things that's really important to understand when we talk about the COVID and the new Omicron variant is we know that the Omicron variant is more transmissible than any of the other previous variants. We know that people who have been vaccinated can also come back positive with Omicron. However, we want to emphasize the importance of vaccination. Getting the full series of vaccinations and being boosted is your best defense against this COVID strain. When we talk about the prevention efforts, vaccination, masks, and distancing, those three put together will be your best chance of preventing any sort of COVID infection as we move along. We do understand that there is some ire out in the public about the mask mandate being lifted. What is also important to understand as well is that when we make policy decisions and when the public health of the island is being discussed, we need to take into consideration the big picture. And as we look at the big picture of where we were standing on the island when it came to the mandate and how masks adherence is what we're seeing during advisories and during mandates, we felt that it was easier for everyone in this prevention, not easier for enforcement, but better for our island when it came to pushing an advisory, because we need to focus on vaccinations. Masks are incredibly important. We never said that they are not. We know masks work, and we are looking for everyone. It takes all of us as a community, as Nantucketers, to work together to put Omicron to rest and to put COVID back on the shelves where it belongs. So if we move along, as we keep going, entering the winter season, we are going to see spikes. We are going to see elevated numbers, but it takes everyone as a community to prevent those numbers from getting out of control. And your vaccination status, mask wearing adherence, and social distancing will help us get through this winter season without any tragic loss of life.
So Roberto, we've got a couple of folks in our audience that have written in. Maybe you could answer these for us. The first question is, reports say that the vaccine has waning effectiveness against Omicron. Why should I still get vaccinated?
So actually a report came out just this morning that even though that people are still getting infected with Omicron, the vaccine was effective at preventing severe illness and hospitalization among 97% of vaccinated individuals. So the vaccine is still one of your strongest and most powerful tools in preventing severe illness.
Thanks, Roberto. Our second question is, reports say that Omicron is much more transmissible than Delta. Do the same mitigation methods work for this variant, meaning masking and vaccines?
Absolutely. Absolutely, the same mitigation standards work. Masks are incredibly important. We do strongly advise that you use them when you're out in public, especially when you're going to be in close contact with other individuals. Wash your hands, cover your mouth when you sneeze into a sleeve, get vaccinated, and maintain distance as much as you can.
We've received the third question, which is, what do we expect the numbers to look like in the coming weeks and months?
So what we're hoping to prevent is large-scale outbreaks. We will see some increased numbers, but don't forget that we saw the same amount of increased numbers at this time last year. Just like we were calling it flu season, we'll be calling it COVID season in the future. We are always going to see increased numbers in the fall and the winter. When I describe increased numbers for Nantucket, in the summer and in the early fall, late spring, what we call our normal numbers is things like 5 to 10 cases a week. In the winter, we may be seeing 10, 20 cases a day as we move forward. But we do need to be important that when you are fully vaccinated, even though cases may seem high, the fully vaccinated population will be able to keep hospitalizations and severe illnesses low.
We've been doing a lot of work here at the Cottage Hospital with the Mass General Brigham system, trying to plan for a surge if that's necessary. What I'd like to say in just closing is that there's a priority within the health system for anything that the islands need. So that's great to hear. But we're all planning for a very large spike in COVID activity in the coming weeks and probably through January and into late February. That said, these cases will come fast. This is a very, very fast moving variant. Delta is still there. And so you'll see a large compression of adjustment, cases going higher very quickly. It could lead to some hospitalizations, but it will certainly lead to people having symptoms, which would require you to quarantine, stay away from work, and then look to be PCR tested before you obviously go back and expose other individuals. We believe that it's more imminent than just a possibility, with folks being close together, a lot of travel occurring, and the infectivity and transmissibility, of this particular virus. So we ask you to mask up, be careful. I'd ask you not to have gatherings if you don't need them. Enjoy your time, with a small group, your family. and be safe this Christmas and over the holiday season as well.